Okay, so we have a young lady who unfortunately had a mountain bike accident and she had a laceration on the right upper lip. It was repaired initially but became a scar tissue and it's been bugging her a lot. It's not that noticeable, but she can notice it, and it's a bump underneath as well. And the small ones are very tricky, so you have to be very, very conservative. You don't want to be aggressive, because then if you cause a bigger divot, then you gotta use fillers and stuff. So be very conservative. That's the key. And have a good plan so that you can hide the scar as much as possible. It's not easy, but do the best. So I'm going to show you exactly what we're dealing with and how we are going to accomplish it. So in the lip area, as we evert the lip, you can see the bump underneath right there. So we are going to try to remove most of that scar tissue. But in the meantime, instead of causing a new scar, the goal is to use the existing line right there, the vertical line, and then remove an ellipse over here, a conservative ellipse. This way the scar gets pulled in and we don't have a new line, just the existing line. That's the goal. And do it minimal, not too much. And also it took a lot of planning. Initially we tried steroid injections, 5FU didn't work, and then we went deciding maybe ellipse over here, but then that could cause a divot and we already have a scar here, so why not utilize that scar and take some of this extra tissue, mostly from the mucosal aspect, not from the vermilion, but the mucosal aspect, mostly in the back, and then very little in this area, very little. So great, we got a plan. Let's get to work. Okay, so let's show you the marking process, and it's really critical to evaluate in the resting position as to what the lip looks like. So let's go take a look together and I'll point out. Okay, so as you can see at rest, the lip looks pretty okay. If you look at it, there's not a huge bulge. So this tiny little thing at rest, we don't want to make it go up like this. Very little, just very tiny. So you can see how easily it would be that we could end up taking too much and causing a divot here. That would be like a terrible mistake. So as much as you're tempted to do a lot to make the patient happy, don't try to do that, because you will make it worse. So just a tiny bit ellipse right here. And only when you go deeper in there, that's where you can take more. But in here, very tiny. So this I'm looking literally at maybe 2 millimeter or something. I'm going to measure it. It says no more than 2 millimeter, and it should stop right there. You can see the existing scar stopping right there, and that's what we'll do. And you have to mark it before the local or it's completely distorted. So that's what we'll do, and we'll show you. So very tiny ellipse, and if you notice, I'm incorporating the scar in it, so this way hopefully we have fresher edges and we can try to evert a little bit. And that's why I went into the mucosal side. If you notice, I went a little bit in a tangent, in like a lateral way, because that's where the bulge is. The ellipse on the mucosa is still small, but underneath I'll dig out the scar tissue a little extra to make sure that we don't have the bulge anymore. So now very important that we don't lose our lines, and I'm going to give the right-sided infraorbital nerve block and then do the scoring of my marking with the 15 blade. This way I don't lose the markings. That's very critical. So let's get to work.